Some important pairs of clinical terms. Measuring and recording joint motion and deformities are important because they provide useful data for the following activities: diagnosis of disorder and injuries of musculoskeletal system, determination of deterioration or improvement or neither in the clinical course of a disorder of injury, objective assessment of the outcome of treatment, either operative or non-operative, communication about a given patient with colleagues and allied health professionals. Terms describing movements of joints: active and passive movement, abduction and adduction, flexion and extension, dorsiflexion and plantar or palmar flexion, eversion and inversion, internal rotation and external rotation, pronation and supination, abduction and adduction, dorsiflexion, palmar or plantar flexion, pronation and supination, eversion and inversion, internal or medial rotation and external or lateral rotation. Terms describing deformities in limbs. Postural deformity is associated with posture. Static deformity is associated with gravity. Dynamic deformity is a result of patient's own muscle action. Fixed or structural deformity. In ankle, they are calcaneus and equinus. Calcaneus is fixed dorsiflexion of foot, while equinus is fixed plantar flexion of foot. For foot, there are cavus and planus. Pes cavus is exaggeration of arc of the foot. Pes planus is diminution of longitudinal arc of the foot. Internal torsion and external torsion. Twist in longitudinal axis of long bone in tibia and femur. There are internal torsion, which is anterior aspect of the distal end is twisted medially, and external torsion is when anterior aspect of the distal end is twisted laterally. Anteversion and retroversion. It's a relationship between the neck of the femur and femoral shaft. Angulation or bowing deformities. For abnormal angulation within a limb, there are varus, conforms to an imaginary circle, and valgus, doesn't conform to an imaginary circle. Varus conforms to an imaginary circle, and valgus doesn't conform to an imaginary circle. These are various types of goniometers for the accurate measurement of joint motion and deformity. And this is the anatomical position of normal person.